Just walking through the hospital when you have one of these dogs with you, it's like a magnet. Staff just approach you, families approach you. You can see the joy on their face, the smiles on their face.
This is the best day ever. This is the best day ever.
It's really important to have dog therapy in a hospital because hospitals are stressful environments. Our dogs bring joy, comfort, and therapeutic support to our patients, our families, and our staff. And that is really the purpose of our Butterfly Paws program.
The Butterfly Paws team consists of volunteer and staff therapy dog program, and those are those dogs that are really supporting the patients' families and staff members to create a calmer, better day for them. These are the dogs that really enjoy pets and love. And then we have our facility dogs. Those are our service animals.
These dogs come with about 50 or plus commands, so they're really highly trained, highly skilled. Those dogs really partner up with clinical therapists, and they will partner with that therapist to help our patients reach their goal intervention outcomes.
Beck, get. That's it. Get. Nice job. My daughter's name is Macie Taylor. She's 8 years old. She has cerebral palsy, and she was diagnosed with that when she was about a year old. Part of the cerebral palsy is she's got a lot of spasticity, so a lot of tightness and things in her left leg. So they just suggested that they do SDR surgery. That's kind of what led us here to this admission. She basically was in a wheelchair afterwards and kind of had to learn to do all the tasks over again, learn to walk again without that spasticity. When we were upstairs on the surgical floor, once we found out that there was a dog, Macie just got, she was so excited. She couldn't wait to get downstairs to start rehab.
When I got to meet her, she already knew that there was a dog here on the unit, and so she was super excited to meet Beck. So every session that we've seen her, we've involved the dog somehow, because she's really enjoyed that and been motivated by that in therapy.
To be able to have Beck every day, to know that she could just kind of hang out with him and she was on therapy at the same time. Just a companion for her, a little bit of home here. She always has a choice whether she can work with Beck or not, and of course she always wants to. They'll do fetch, so if she's throwing the ball to play fetch, they'll work on reminding her, keep your foot down, keep your ankle down. They'll walk around the hallways and around the unit. She'll hide his toys. And that whole time she's working on throwing, balancing while she's throwing for him. Something fun for her to do while they're still incorporating all of her therapy. All the things that she's done to this point is beyond my expectations that we would have been able to do before we got out of here. I was hoping just that she'd be able to walk out of here, and she was dancing in the elevator and doing cheers and stuff for the football game. So she's done way better than I ever thought she would.
Because we see those outcomes and see those benefits with the few dogs that we have here right now, the 7 that we have right now, we are motivated and excited to get us up to 70 dogs over the next couple of years. And that's what the growth of the program is for.